And of course, while there's lots of shiny metal and tractors, machinery, you name it here at the Ploughing, it's not just the machinery that needs a bit of a service and a bit of a grease behind the ears, is it? It's the farmers as well. So I'm here with HSE to find out just a little bit about some of the health things that you should be looking out for yourself. And I'm here with Celine Daly, who's a nurse, a dermatology nurse specialist, who'll be talking to us about skin cancer today.
Yes, thank you for having me.
So Celine, why is this something that farmers in particular should be worried about?
Well, we know that 1 in 3 of us will develop a skin cancer at some point in our lives. We know that 1 in 4 deaths from skin cancer actually occurs among people who work outdoors, as farmers, builders.
Right.
So we know what causes skin cancer, which is good news. Some cancers we're not sure what the cause or factor is. We know with skin cancer, it's sun. So 90 to 95% of skin cancers are caused by overexposure to UV rays. So farmers, being farmers and being out all day long, 365 days a year, are going to be more at risk of developing skin cancer. So there's 2 really key points here. One's to be sun smart, that's to prevent us from developing skin cancers. So we're in a high factor of 30 or 50 every day between March and September.
In Ireland?
Every day between
Oh,
March
wow.
and September. I know, really hard mess to get over, but look how beautiful it
Yeah.
is here today. And
It
it can
is,
burn
yeah.
when it's a cloudy day as well. And if you're out all the time, it's important to take protection all the time against the sun. Wearing a hat, wearing long sleeves, a shirt with a collar, and staying in the shade if you can between 11 and 2. I know that's difficult. So
Yes.
sun smart is the first bit of it, and then surveillance is the next bit. So keeping an eye on your own skin or your partner's skin for any changes.
And how do you do that? Tell me,
So
you know.
it's actually really simple. You don't have to be qualified then, but all you have to do is know what your skin looks like on a baseline.
Right.
So know what's normal for your skin. If you develop anything new, a lesion that bleeds, a spot which bleeds and doesn't go away, develops a crust, a lesion that looks black or brown in colour or develops 2 or 3 colours within it, or it bleeds or changes, develops an irregular border, you must go to your GP immediately and have that seen too. So
Right.
if you develop any lesion on your skin which wasn't there before and you have been outdoors, like you've been a farmer, it's really, really important to go to your GP and have your skin examined and seen.
Brilliant. I'm sure our readers will know to look out for that now. Thank you very much, Celine.
You're welcome.
So Dr. Martina Healy has joined me to explain a little bit about sepsis as well. So Dr. Healy, can you explain, first of all, what is sepsis?
So it's a life-threatening illness which is caused by the body's response to an infection.
Right.
And as a result of that, lots of the organs in the body start to shut down. Now, it's important to say we all get infections, but not every infection leads to sepsis. So it's important to be able to pick it up and differentiate infection from the life-threatening illness.
And tell me, how exactly do you do that? How do you know if it's just something normal that's going to run its course, or how do you know, goodness, this is a little bit more serious, maybe I should contact my GP?
Yeah. So I think we've all had the flu, viral illnesses, and you go through a period of time where you feel unwell, you take your normal drugs for fever and so on, and you usually start to get better within 24, 48 hours.
Right, so it's a duration. If it starts to go on a little bit longer,
I think that's the point. I think
that's
the
maybe
point
when you get
is
worried.
if it doesn't get better or you begin to feel worse.
Right.
And I think there are specific signs about feeling worse that are important to pick up. Maybe things like joint pain, progressing to feeling drowsy, not being able to wake somebody up if you're a carer, if you have a child, and probably the feeling that I feel like I'm going to die. That's the time. And it's often
which you'd never hear any farmer say, I can tell you that.
Well,
They'll
it has
just
to
keep
be
going,
pretty
don't they?
bad before the farmers admit to that.
And is that why this message is important to farmers in particular then? Is that one of the reasons?
Yeah, so I think we've all been brought up on farms. We
Yeah.
all get cuts and bruises. I actually have quite a few on my hand. I think the farmers tend to, they get lots of cuts, bruises. They say it'll get better. I think then maybe if you have redness, swelling, a temperature, and it's progressing, I think that's the time to go to your local GP or your local ED department.
Dr. Healy, thank you very much for your time. Here with Dr. Tony Maloney, vascular consultant, here to talk about arterial peripheral disease. Can you just explain to me a little bit, first of all, about what this is? And
Sure.
Yeah.
So it really is the poorer cousin of coronary artery disease. And a lot of people understand coronary artery disease because
Yes.
people present with heart attacks or chest pain when they walk. And actually, peripheral arterial disease is the same thing, but in the legs. So patients experience cramps or tiredness in their calves. So that's called peripheral arterial disease.
Right.
And so the key to it is that it's brought on by exercise, and it's relieved by rest.
Oh, right. Okay.
And as you age, it actually increases in incidence. So particularly those over 70, actually up to 19% will have some element of arterial disease in their peripheries or peripheral arterial disease.
And tell me about, is this something that farmers in particular should be concerned about?
Well, if they have, in particular, if they have risk factors, and anyone really who has risk factors, and the main 4 risk factors are cigarette smoking,
Right.
which really appears to be the biggest trigger, diabetes, which of course is increasingly common, high cholesterol, which, I mean, of all the patients we screened this morning, I would say most have high cholesterol, and then high blood pressure.
And is that quite typical, or is that something you've just noticed at the Ploughing? I know you would go out to events quite a lot.
Yeah, no, that's very typical. And,
Right.
As I said, most patients with the diagnosis of peripheral arterial disease would have a history of cigarette smoking.
Okay.
Yeah.
And if you do notice any of the signs, what should you do? At what point do you need to get help?
The key to peripheral arterial disease is early recognition of signs.
Right.
And while, of course, you can improve the condition by yourself with exercise, certainly if you think you have a diagnosis or you think you have symptoms suggestive of a diagnosis of arterial disease in the legs, you should talk to your GP.
Okay.
Not only because of that problem, but because it's associated with increased risk of heart attack and an increased risk of stroke. So it's really, prevention is better than cure in terms of arterial disease. Actually, very few patients go on to have advanced arterial disease, and even fewer again require an intervention.
And the good news is that you actually have a bit of a diagnostic room in behind us here, don't you, as well?
So we're screening patients today based on a questionnaire. If you have a risk factor, then you'd be screened.
So if you are in that risk category and you're worried about it, come on down to the stand.
You should come and see us. Yeah.
Brilliant.
Yeah.
Thank you very much,
My
Dr.
pleasure,
Maloney.
no problem at all.